Measles isn't just a faded childhood memory, a benign rash we vaguely recall. It's not simply a rite of passage from a bygone era, it's a highly contagious and dangerous viral infection. A disease that spreads with alarming ease through the air, capable of infecting nearly everyone exposed who isn't protected. This isn't a mild inconvenience, it's a serious health threat. Measles still threatens communities today, lurking just beneath the surface, ready to resurge if given the opportunity. It doesn't discriminate, endangering entire populations regardless of background or location. The potential for widespread outbreaks is a constant concern. Thanks to widespread vaccination efforts, we rarely see it in many parts of the world, a testament to the power of preventative medicine. The success of vaccination programs has lulled many into a false sense of security. But the measles virus itself hasn't changed or weakened. It remains as virulent and infectious as ever, a constant reminder that our guard cannot be let down. The virus is a persistent threat, waiting for an opportunity to exploit vulnerabilities in our defenses. When vaccination rates drop, even slightly, measles can return quickly, with devastating consequences. A decline in herd immunity creates pathways for the virus to spread rapidly, impacting entire communities. This puts everyone at risk, from the youngest infants to the most vulnerable adults. The ease with which measles spreads in crowded environments makes it a particularly dangerous threat to public health. It's especially dangerous for infants too young to be vaccinated and those with weakened immune systems, who are at the highest risk of severe complications. These vulnerable populations rely on the protection of herd immunity to stay safe. Measles is far more than just a rash and fever. It's not a benign childhood illness to be taken lightly. The symptoms are just the tip of the iceberg, masking the potential for serious and long-lasting health problems. It can cause pneumonia, a serious lung infection that can lead to hospitalization and even death. Pneumonia is one of the most common and life-threatening complications of measles. Brain swelling, also known as encephalitis, is another devastating complication that can result in permanent neurological damage. This can lead to seizures, cognitive impairment, and other long-term disabilities. Measles can lead to permanent disability, altering the course of a person's life forever. The long-term consequences of measles can be profound and far-reaching, and even immune amnesia, a frightening condition where the body forgets how to fight off previously encountered infections. This leaves individuals vulnerable to a wide range of illnesses they were once protected against, leaving people vulnerable to other infections, turning common illnesses into potentially life-threatening situations. The impact on the immune system can be long-lasting and debilitating. Preventing measles through vaccination is far easier, more cost-effective, and safer than treating its devastating complications. Vaccination is a simple and effective way to protect yourself and your community. Staying informed about measles and ensuring we are all vaccinated is a responsibility we all share, a collective effort to protect the health and well-being of our society. We must work together to maintain high vaccination rates and prevent outbreaks. It's crucial to keep our communities safe, ensuring a healthy environment for everyone to thrive. Protecting our communities from preventable diseases is a shared goal that benefits us all. Let's make sure measles remains a disease relegated to the history books, not a resurgent threat jeopardizing our future and the health of generations to come. We have the power to prevent measles, let's use it. Measles stands out as one of the most contagious viruses known to humankind, a distinction that underscores the importance of understanding how it spreads and how we can protect ourselves and our communities. Its ability to transmit rapidly makes it a significant public health concern. The primary mode of transmission is through the air, occurring when an infected person breathes, releasing the virus into the surrounding environment. This highlights how easily the virus can spread in enclosed spaces. The virus becomes airborne when an infected individual coughs or sneezes, expelling tiny respiratory droplets containing the measles virus. These droplets can then be inhaled by others nearby. The measles virus exhibits remarkable resilience, capable of lingering in the air or on surfaces for extended periods, increasing the risk of transmission even after the infected person has left the area. Specifically, the virus can remain infectious for up to 2 hours after an infected person has left a room, emphasizing the need for caution in shared spaces. Due to its airborne nature and persistence, you don't need direct contact with an infected individual to catch it. Simply being in the same room can be enough for transmission to occur. A person infected with measles is contagious for about 8 days in total, making it crucial to identify and isolate cases promptly to prevent further spread. Alarmingly, the contagious period starts 4 days before the characteristic rash appears, meaning individuals can unknowingly spread the virus before they even realize they are infected. This pre-symptomatic transmission is a key factor in measles outbreaks, often spreading the virus before anyone realizes the danger, making early detection and preventative measures all the more critical. In a room filled with unvaccinated people, the risk of infection is incredibly high. Studies have shown that up to 90% of unvaccinated individuals will get infected if exposed to the measles virus, highlighting the importance of vaccination in preventing widespread illness. That's precisely why high vaccination rates are absolutely crucial for community health and safety. When a large proportion of the population is vaccinated, it creates a firewall, a protective barrier that effectively stops outbreaks before they even have a chance to start, safeguarding the entire community. However, it's important to remember that even small gaps in vaccination coverage can create opportunities for measles to spread rapidly through a community, potentially leading to outbreaks that could have been prevented. Ultimately, community protection depends on everyone doing their part by getting vaccinated and staying informed, ensuring a healthier future for all. Measles symptoms can sometimes be tricky to identify initially. They often mimic the common cold, which can lead to delays in diagnosis and treatment. It's important to be vigilant and pay close attention to the specific symptoms that differentiate measles from a regular cold. One of the first indicators is a high fever, often reaching 104 degrees Fahrenheit, 40 degrees Celsius, or higher. This is accompanied by a persistent cough, which can be quite severe and distressing. You'll also notice a runny nose, similar to a cold, but often more profuse. The eyes become red and watery, a condition known as conjunctivitis, making them sensitive to light. After a few days, typically 2 to 3, tiny white spots, known as complex spots, may appear inside the mouth, usually on the inner lining of the cheeks. These spots are small, slightly raised, and often described as resembling grains of salt on a red background. These complex spots are a telltale sign of measles and can help differentiate it from other viral infections. The classic red, blotchy rash, the hallmark of measles, typically starts on the face, often around the hairline. From there, it spreads down the body, covering the neck, trunk, arms, and legs. This rash usually appears 3 to 5 days after the initial symptoms, such as fever and cough, begin. Unlike some other rashes, the measles rash isn't usually intensely itchy, although some mild discomfort may be present. Despite the appearance of the rash, the fever often remains high, indicating the body is still fighting the infection. Measles is not a short-lived illness. It can last 2 to 3 weeks from the onset of symptoms. It's crucial to be aware that complications are most likely to arise during this extended period, especially in young children and adults with weakened immune systems. Even after the rash fades and the acute symptoms subside, the immune system can remain weakened for several weeks or even months. Therefore, continued rest, proper nutrition, and close monitoring are essential to support recovery and prevent secondary infections. Recognizing these signs and symptoms early on is paramount, not only for the individual's health, but also to prevent further spread of this highly contagious disease within the community. If you suspect measles based on these symptoms, it's vital to act quickly by contacting your healthcare provider and isolating the affected individual to protect others from infection. Anyone unvaccinated is at risk, but infants, people with weakened immune systems, and those who can't be vaccinated face the greatest danger. For them, measles can lead to life-threatening complications like pneumonia, brain swelling, and even long-term disabilities. Pneumonia is the leading cause of measles-related deaths in young children. Rarely, measles can cause fatal brain diseases years after infection. Even less severe complications, like ear infections or diarrhea, can have lasting effects, especially in children. Community immunity protects those who can't be vaccinated. Measles is not a mild illness. It's a serious threat that demands prevention. Protecting the vulnerable is everyone's responsibility. The measles vaccine is one of the safest and most effective ways to prevent the disease. It uses a weakened virus to train your immune system, so you build strong, lasting protection without getting sick. One dose is about 93% effective. 2 doses, about 97%. High vaccination rates create herd immunity, shielding those who can't be vaccinated. Every vaccinated person strengthens this community shield. Skipping vaccination creates cracks in our protection, risking outbreaks. Vaccination is a shared commitment to public health. In Canada, children get 2 doses of the MMR or MMRV vaccine first at 12 months, then again between ages 4 and 6. The first dose is timed to ensure the child's immune system responds fully. The second dose boosts immunity, catching anyone who didn't respond to the first. Adults born in 1970 or later who aren't sure of their status should check with their healthcare provider. Some adults, like healthcare workers or travelers, may need 2 doses. Infants traveling to high-risk areas may get an early dose, but still need the regular schedule. Following these guidelines is the best way to stay protected. Vaccination isn't just for kids, it's for everyone. If you think you've been exposed to measles or develop symptoms, isolate yourself at home right away. Don't visit public places. Measles spreads before the rash even appears. Call your healthcare provider before going to a clinic or hospital so they can prepare and protect others. Testing may involve a blood sample or throat swab. If you're unvaccinated, getting the vaccine within 72 hours of exposure can sometimes prevent illness. Those who can't be vaccinated may receive immunoglobulin to reduce severity. Follow your healthcare provider's advice to protect yourself and your community. Quick action helps stop outbreaks before they start. Protecting our communities from measles starts with vaccination. Make sure your records are up to date. If you're unsure about your status, talk to your healthcare provider. Keep immunization records current and report them as required, especially for school or childcare. Practice good hygiene, wash hands often, and teach kids to cover coughs and sneezes. Stay informed with reliable sources and share accurate information. Vaccination is our strongest defense, but every healthy habit helps. Together, we can keep measles out of our communities for good.